Welcome to my channel, only Ankylosing Spondylitis channel. Today we discuss coronavirus and its effects on ankylosing spondylitis patient. Update March 15, 2020. As the coronavirus COVID-19 continues its global spread, many of you in the spondylitis communities have reached out with concern about how it may affect you. Should those of us on immunosuppressed be more worried about the coronavirus than the general public? Some rheumatology patients, particularly those on steroids and biologics, will be immunosuppressed and should therefore be considered high risk. All patients should, however, continue to take their medication unless directed otherwise by their rheumatology team. If you are planning to start or switch to a new medication, this may now need to be reviewed. Remember that the drugs we use for ankylosing spondylitis treatment have different infectious risks. People on high dose of prednisone are at risk of a variety of infection. Those taking TNF inhibitors are at high risk for microbacterial infections such as tuberculosis. Those taking IL-17 inhibitors such as secukinumab, coxantrix, or ixekizumab are at risk for fungal infection such as Candida, and those taking genus kinase JAK inhibitors such as tofacitinib or zalzenage, baricitinib, olumiant, or upadacitinib, Rinco are at the risk of Herpes zoster shingles infection as long-term complication of the chickenpox, varicella virus. How these drugs might complicate a COVID-19 infection is currently not known. However, be mindful of something else. People who are HLA-B27 positive demonstrate increased natural immunity towards a number of viral infections such as HIV-1, hepatitis C, and influenza, although whether this natural immunity carries over the coronavirus has not been studied. Should I stop taking my biologics? Popular question. If you are showing sign of any active respiratory infection, you should not be taking your biological, but talk to your doctor before stopping any medication. If infected, how long is the duration of the illness? Popular question. Because so many of the Chinese patients sheltered in the place at home, we don't know this. We do not know those who were sick enough to need to be hospitalized, were in the hospital for an average of 12 days. Means 12 days required. What happens when you are infected from coronavirus? The virus multiplies within the lower respiratory tract where symptoms develop. Earlier one or fever and cough. Most people will recover within a few days, but about 20% go to the develop serious pneumonia as their lungs become inflamed. They may need a respirator to help them breathe. The CDC advises those at higher risk to do the following: avoid crowd and stay home as much as possible. Limit close contact with others in public. Try to avoid touching high touch surface in public place and wash or disinfect hands often. Ask your doctor about obtaining several extra weeks worth of medication in case you need to stay home for a prolonged period of time. Digging deeper, virus behavior, preventative measures, and many more. The following information has been compiled from trusted source to give you a quick access to what you need to know about the coronavirus. We hope you find this pretty helpful to survive, protect your health and that of your loved ones. Virus behavior. What is the coronavirus and what are the symptoms of COVID-19? This virus is a part of larger coronavirus family, all of which usually causes mild to moderate respiratory tract infection. However, sometimes a coronavirus outbreak originates from an animal sources and can cause severe disease activity. COVID-19 coronavirus disease 2019, which emerged in December 2019, in one such as case. The disease can range in severity from patient to patient, causing a mild flu-like illness in some and acute respiratory distress in others. Symptoms may appear 2 to 14 days after exposure and can include fever, cough, shortness of breath, complications such as pneumonia. While the risk to the general US public remains low, more cases are likely to emerge in the coming days and week too. The most important things you can do is arm yourself with knowledge. How does the virus spread? Popular question. It's from person to person. The coronavirus mainly spreads from person to person contact according to the CDC. The virus is transmitted through tiny respiratory droplets, mucus or saliva produced when an infected person coughed or sneezed. Close contact with an infected person increases the risk of transmission, so it is recommended to keep distance at least of 6 feet. By touching contaminated surfaces, infectious places. Prevention advice. What are the prevention advice for coronavirus? What are the best way to avoid contracting the coronavirus? Do face masks protect against the spread of the virus? If so, which type of mask is best? Face masks should only be used by people who show signs of symptoms of COVID-19, according to the CDC, to help prevent the spread of respiratory droplets and avoid transmitting the illness to others. The most effective mask for those who are sick or caring for someone who is sick, an N95 mask, which block 95% of small particles. The surgeon generally has urged those who are healthy to stop buying masks, since stockpiling will create a shortage for healthcare professionals. Does washing hands with soap and water help? Is antibacterial necessary? Yes, washing your hands with soap and water for at least 20 seconds is a strong preventative measure and should especially be done before eating, handling food, or touching your face. If you cannot wash your hand, use a hand sanitizer with a content of at least 60% alcohol. What else can I do to maintain wellness? Practice self-care. Stress and anxiety, especially of chronic nature, are known to suppress immune system function. Worry about the coronavirus is of course natural, but compounded with the stress, many living with ankylosing spondylitis already suffer. This feeling can take a miserable toll. Do what you can do. Get enough rest, good nutrition and hydration, exercise, and practice mind-body technique for relaxation, such as meditations or mindfulness. In short, continue to pursue healthful living. What you already know will serve you when it comes to taking care of yourself during this time. Some useful website links are given below. Click and find the more details about coronavirus. Here are the four main link of website which can be well benefits for you. Where can I access further advice? For more information, you can contact here. Very important number. This is an Indian coronavirus update website. The helpline number for coronavirus. In the link for corona update, any information regarding coronavirus, you can click in this link. very useful link, very important. Now, हिंदी इंफॉर्मेशन। जो लोग गठिया रोग से पीड़ित है वह लोग जो कि गठिया रोग की दवाएं जिनमें रोग प्रतिरोधक क्षमता कम होती है, इम्यूनोसप्रेशन, जो मरीजों उन दवाओं पर होते हैं उनके शरीर में से इन्फेक्शन पड़ने की ज़्यादा संभावना हो सकती है। इसका मतलब यह बिल्कुल भी नहीं है कि वो अपने गठिया रोग की दवाएं बंद कर दें, ना वो ज़्यादा घबराएं। इसके लिए बस यह ज़रूरी है कि वह ज़्यादा से ज़्यादा प्रिकॉशंस रखें। इससे बचने के लिए किसी बीमार जुकाम, निमोनिया से ग्रसित व्यक्ति से संपर्क में आने से बचें। मास्क पहनें, अपनी आँखें, नाक और मुंह को ना छुएं, हाथों को बार बार अच्छे से साबुन से धोएं। कोरोना वायरस का संक्रमण को कम करने के लिए उपाय करें। नंबर 1, अपने हाथ साबुन और पानी या अल्कोहल युक्त हैंड रब से साफ़ करें। नंबर 2, खांसते या छींकते वक्त अपनी नाक और मुंह को टिश्यू या मुड़ी हुई कोहनी से ढकें। जिन्हें सर्दी या फ्लू जैसे लक्षण हों उनके साथ करीबी संपर्क बनाने से बचें। नंबर 4, जंगल और खेतों में रहने वाले जो जानवर हैं उनसे असुरक्षित संपर्क ना करें। ये भी रखें सावधानियाँ, क्योंकि जानकारों के मुताबिक संक्रमण के बचाव के लिए 20 सेकंड तक साबुन से अच्छी तरह हाथ धोएं। किसी भी मरीज को सीधे छुए नहीं। खांसते या छींकते समय नैपकिन या कपड़े से मुंह को ढांकें। सफ़र के दौरान N95 मास्क का इस्तेमाल करने की भी हिदायत दी गई है। एडवाइजरी के मुताबिक अगर आप संक्रमित है या इन्फेक्शियस है तो तत्काल नज़दीक के हॉस्पिटल में मास्क लेकर पहने। स्वस्थ रहिए और अपना ख्याल रखें। थैंक्स फॉर वाचिंग। हमारे चैनल को देखने के लिए बहुत बहुत शुक्रिया। सब्सक्राइब कीजिए अगर आपको और अपडेट्स लगातार चल जाते रहे एंकोलाइजिंग रिलेटेड। शेयर करना ना भूलें अगर अपने दोस्तों से मोहब्बत है। सब्सक्राइब करने के लिए या व्हाट्सएप से ग्रुप से जुड़ने के लिए आप ये नंबर में क्लिक कर सकते हैं। शुक्रिया।